You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We're talking about dental implants today. And with us, we had him on the program in 2014, and he's got a stack of before and after photos. Dr. Eric Benefield, welcome to the program.
Thank you, Randy.
Now, you have a lot of photos. We're going to try to get to as many of those as possible.
Yes.
Now, for people that don't know your dental implant practice, who's the typical patient that comes in for implants?
So usually two types of patients.
Okay.
The most typical patient for sure is somebody who has all their teeth or most of their teeth, but they are struggling. Their teeth aren't their friends anymore. They know that. They have bleeding gums. Maybe they got some teeth that are just tooth roots left. So they know one thing, and that is that they don't want a denture. They're terrified. They think that may be their only option, and so they come to me hoping that there's an option that's not a denture.
And you give those people like a brand new set of teeth?
We do a set of teeth that don't come in and out.
Okay. Who's the second group?
Second group is somebody who's already missing all their teeth. Maybe they've been wearing a denture for a year and they've discovered that they hate it, or they've been wearing dentures for 40 years and they've discovered there's something way better out there that maybe they didn't know about, or somehow they've found out that life is better with teeth that don't come in and out. So for those people that currently are wearing a denture, literally they can come in, we can give them in one day a set of teeth that don't come in and out, and it's completely different than what
you said when they walk in, like a denture wearer, they could walk in with no teeth and walk out that same day with teeth, upper and lower teeth that don't come out.
Yeah.
That you potentially could print those teeth with your in-house lab in the other room.
Absolutely. It's crazy. Technology has invaded dentistry, and so we're very fast and efficient compared to the way things used to be.
So what's changed? Like, I had you on the program in 2014. You were doing implants back then. What are some of the changes?
Yeah, so back in 2014, a lot of the implants that we did were what we call a snap-in, snap-out set of teeth, which is basically a denture that clicks into implants, snaps into them, but the patient can take them out. And through the years, I've come to really love teeth that don't come in and out, because that's what I've discovered that our patients love. So that's one big change, is we do a lot more teeth that don't come in and out.
Okay. Is it easier? Because, I see that trend. A lot of snap-in dentures. Is it easier for the doctor? I mean, is that why you did it initially? I mean, you thought it was probably the best way to go at the time?
Yeah, a less experienced doctor kind of gets their feet wet into implants, I think, by doing simpler things. Replacing somebody's teeth with teeth that do not come in and out is a very advanced, complex thing. And so, I think it's a natural progression for a dentist to sort of go through that and eventually realize this is the thing that works the best, that people love, that acts like real teeth. And so, I mean, I think for sure it's a natural progression.
Now, when most people think of Colorado, you think of it as such a healthy place. Are there that many people that have really bad teeth, or they're in a denture? Is it a big problem over there?
I mean, Colorado is definitely a healthy place. People get out and about and hike and stuff. And so, I mean, we're all about fitness and health. You would be amazed at how many people are missing the majority of their teeth or need to have their teeth out. It's way more common than you would know, because someone like you or me, we don't see their teeth because those people have learned how to hide them in a
they
crazy
don't smile.
way. You'd be amazed at how effective people get at hiding this problem that they know is happening, and they don't want other people to know about it.
Can you spot it as a dentist when you're out and about, like who's hiding their teeth?
Yes and no. I mean, I can definitely spot when a patient comes to me and they're hiding it. I can see it. A man will grow a big mustache that almost is too long, covers over his teeth. Because it distracts and hides. So I mean, it's amazing how effective people get at not showing. And so you and I wouldn't know how many people are out there. There's a ton. So you asked me a minute ago what has changed since 2014, since our interview. Another thing that's really changed is my appreciation for just what this does for people outside of teeth. You go to dental school, you learn how to fix teeth, you learn about teeth. Your life revolves around teeth. And then you start doing full mouth restorations for people, and you realize it affects a lot more than, I mean, it's a tooth problem, but that problem has radiated into the whole rest of their life. And so fixing their teeth, it's amazing what else it fixes. It brings craziness into somebody's
Like
life.
charisma, or they smile more?
Can I show you with some
yeah,
pictures?
Yeah, let's take a look.
Okay. Let me show you Shelly, because I feel like her story illustrates exactly what I'm telling you.
Okay.
So this is Shelly before. You know how we talked about people learn how to hide?
Yeah.
If you look at Shelly's before, you would have no idea, because she has learned really closely how to mask that there's a problem. So you see her front teeth. Mm-hmm. She's got a pretty smile. Those front teeth were her only 6 teeth. They were part of a bridge.
Oh, wow.
She had learned so sophisticatedly how to mask everything else that was going on. She didn't have any bottom teeth, but she had a partial that used to be supported by bottom teeth. And
so she couldn't eat?
At all.
Very well.
In fact, Shelly brought me a list, 19 items of this is what I want in my life that I don't have right now. And it was things that you and I wouldn't even think about, that we just take for granted.
Okay.
Her 99-year-old grandma has a garden. So she grows fresh fruits and veggies. One of Shelly's 19 things was, I want to just enjoy my grandma's garden with her. I want to eat carrots, bell peppers, cucumbers, whatever, with her, like with my grandma. Instead, I have to take them into another room and liquefy them and enjoy the fruits and veggies in a drink.
Okay.
I can't sit down with my grandma and enjoy this hard work that she's been doing. Anyway, her list was stuff like that you and I wouldn't even think about. I want to have a bubblegum blowing contest with my grandkids. I want to be able to say yes to my husband when he says, do you want to go for a walk? And right now I can't say yes, because I'm afraid we're going to run into somebody, and I'm going to have this terrifying experience of talking to somebody, and all I'm doing. Yeah, I mean, her whole life was always about her teeth. So she brought us this list, and she told me, I've been watching you on TV for 3 years.
Okay.
And I wrote down the phone number. In fact, she said, I watched you and Randy Alvarez.
Okay, okay.
So she wrote down the phone number and said, I need to call, but she was terrified. And so it took her 3 years. She finally worked up her nerve to call. And the reason that she called, she said, is she felt like she was super scared that she had waited too long. And now, what if I don't have enough bone to do implants? I'm going to have to wear a denture.
Okay.
And that terrified her. She couldn't handle the thought of that. So she came in, and she was thrilled to find out that we could replace her teeth in one day with a set of teeth that don't come in and out. And so she literally went
upper and lower.
Upper and lower.
Okay.
In a day. So take a look at the after.
Very nice.
Literally the day after her surgery, she can kiss her husband without being afraid that her partial is going to fall into his mouth.
Is that what she told you?
She did. That was one of her 19 things.
Okay.
She can go to her mom's 80th birthday party and just be a normal person without worrying about, is something going to fall out? Am I going to, instead of having her teeth always on her mind, she could just live a normal life. And that's what she wanted. Those 19 things could be summed up in, I just want to live a normal life. I don't want every day to be focusing on my teeth. So that's what she got in one day. She loves it. So literally, when I ask her, are you glad you did it? Her only regret is, I wish I would have had the 10 years, 15 years, whatever it was. I wish I had done it sooner, so that what I'm experiencing now, I could have been experiencing for all this time. So anyway,
very nice. Very nice.
Awesome story.
And what do patients like more? The way it looks, or what they could eat?
So it's pretty hilarious, because sometimes somebody will come in and say, I don't like the way my teeth look, and I want them fixed. And so we fix them with a set of teeth that don't come in and out, dental implants in a day, and they'll come in later and say the opposite thing. So if I didn't like the way my teeth looked, now I love that I can chew and eat what I want to. And I'll say, well, what do you think about how they look? Oh yeah, I love the way they look too, but this other thing. Or they might come in and say, I want my teeth to be strong and be able to eat whatever I want to. And then they'll come in and say, man, I get so many compliments about my teeth.
Is that right?
Yeah.
So it kind of shifts.
It does. I mean, they still appreciate what they knew they would appreciate, but it's kind of like they go hand in hand.
What's it like when they look in the mirror for the first time?
Man,
many of these people.
I love taking videos the day after. I got a great video that I can't show you, but I'll show you the before and after of Christy. Christy's video the day after her surgery, so literally it's been less than 24 hours. She cried and said, when I got up this morning, I was sedated yesterday, so I don't remember anything, but I got up this morning and I looked in the mirror and she just starts crying and she says, and I have this. Anyway, look at her before. Her sisters made fun of her. She works in a restaurant. She had to come out and talk to people. And when we wore COVID masks,
Yeah.
she could finally be herself, and she realized, I haven't been myself for a long time. And so in a day, check out her after. That's the first selfie that she ever took.
Wow. That's a dramatic difference.
It is. Can you see the shape of the smile?
Yeah.
It fits her face a lot better. So Randy, when you look at her picture side by side, before and after, would you say that after she looks more attractive than before?
Yes, for sure.
That's everybody. You know, we do this procedure in one day, a set of teeth that don't come in and out. They always look more attractive afterwards.
So the teeth make you look better.
Absolutely.
Well, this is pretty obvious here.
Sure.
She's got to be thrilled with that.
Yeah, a picture speaks 1,000 words, right? Yeah. So we could go through a long list of, let's compare the before and the after. Does she look, better in one way or the other?
She looks a little younger too, for sure.
Absolutely. Yeah, you might not even know it's the same person.
I would agree with that. I think anybody watching this.
When Christy came in, for example, the first day I met her, she explained her problems. We took her pictures. We take some preliminary images so that we can pre-plan her surgery.
Okay.
We do what's called a computer-guided surgery,
okay.
Which we can get into the details if you want to, but it's amazing because we plan it out ahead of time so that the next time we see that person is their day of surgery.
Okay. So in little as 2 or 3 appointments,
yes,
they get their new teeth.
Yes.
And you mentioned it's computer guided surgery. I guess you're doing it on a computer ahead of time. Is that the way it's always done?
No, it's not.
Okay.
Honestly, that's not the way we do it 100% of the time. Sometimes a patient might have an event that they're trying to get their teeth done before they go, an anniversary, whatever, a graduation.
Okay.
If they're in a hurry and we don't have time to do a computer-guided surgery, we don't have to. But I like to do it that way because it's precise.
Okay.
And so, yeah, it requires a little bit of time. If you needed it next week, we probably couldn't do the computer-guided. If you needed it next month, then we could.
How old can you be to get this done? Like, what are the upper age ranges? Like, what's your oldest patient?
My oldest patient who's had this procedure done was 99.
Why would a 99-year-old want to do this?
Well, Randy, if you were 99, what do you think your life would revolve around?
Okay.
I guess
eating.
There's not a lot, right? Howard's life revolved around, believe it or not, Burger King Whoppers. He loved Whoppers, and he got to where he couldn't eat a Whopper. Now, I like Burger King, but he loves Burger King. And so he came in and said, I want to eat Whoppers, and I can't.
Was he wearing a denture or just bad teeth?
Just bad teeth. Actually, he had a denture on the top and bad teeth on the bottom.
Okay.
But anyway, at 99, that's his life. I want to enjoy my food. So what we did for him is, in a day, took out his bad teeth, put in implants, put in a set of teeth that don't come in and out. He walked out that day able to go to Burger King and eat his Whopper, like right there. Now, he's got healing and stuff, but he's eating. He's functional.
So once they're healed up, they can eat whatever they want, like with regular teeth. Whatever you can eat with regular strong teeth, you can eat with these?
Once they're healed, they can eat anything they want to. We have a little healing time where we have them eat softer stuff. But yes, once they're healed,
now, what about medications? Because most people, even statistically over 75, are on 4 medications. Can you be on medications like diabetes medications or osteoporosis meds or whatever and still get this done?
Sure. I mean, short answer, yes. And so we partner with their primary care physician. We get all of our ducks in a row. But the bottom line is almost all patients who are on some sort of medications, we're able to move forward and get them their teeth that don't come in and out.
Okay, good. Time for some more photos.
Yes. Let me show you Barb.
Okay.
Barb was so afraid. She, like a lot of patients, she had traumatic experience as a kid at the dentist. And so, they carry that into their adulthood. This whole pile, probably 90% of these people are terrified. Barb was so afraid that they saw us on TV.
Okay.
Guess who?
All right.
And her and her husband both were having significant problems. Gum infections, loose teeth, pain. I mean, it's a cycle that people that are going through this recognize. So they came in together, and Barb could hardly walk through the door. I mean, the threshold, that goes into our office, couldn't hardly even get herself to step through there just because, she's terrified. But she came in with her husband, Dave, and she wanted to see his process. So we gave Dave upper and lower teeth supported by dental implants. She saw his whole process.
Okay.
Eventually, as he went through the healing and could use his teeth, she came to a day of reckoning where, her infection got really bad. She was in severe pain, and she knew she had to move forward, even though she was still super scared. So what did we do? We gave her a full set of teeth on the bottom that don't come in and out, supported by dental implants. On the top, she is phasing it.
Okay.
So we started by making her a cosmetic denture on the top.
Looks good.
It does. If you look, it fits her lower lip. In fact, it was important to her that it not be like a perfect white picket fence. And so if you look, it fits her face just right. That's what she wanted. What would you say? Back to our
She looks a
questions.
little younger.
Does she look
Yeah.
younger? Does she look more attractive?
Yeah.
Barb is not the same person that I knew. The one that was terrified to walk through the threshold or over the
That's
threshold.
behind her.
She comes by herself. She's brave.
Okay.
She gives me a big hug every time. I mean, she's not the same person. Her confidence level is through the roof.
And we were talking in the green room where you say a lot of the patients will tell you, Doctor, you've changed my life. You hear that a lot?
I do hear that. And, they don't quite get it because they're the ones that changed their life. They let me have a part of it, but they took the action. In fact...
Because that's the hard part, right? Just getting up the nerve to...
Yeah, let me tell you about Vic.
Okay.
So you asked me if people say, you changed my life. Vic is such a perfect example. He came to me. He had been watching our show for a couple of years on TV. Couldn't get up the courage. He was trying to muster the courage to call. Finally, he did. So Vic hadn't been to a dentist in 30 years.
Okay.
He was terrified, very scared. Over the course of those 30 years, his condition in his mouth got worse and worse and worse. He couldn't eat. He couldn't be comfortable around people. He felt like he's a people person, but he felt himself kind of shrink in and in and in because of his embarrassment. He had pain, and so he came to me after a couple of years of building up his courage and just said, I'm ready to change my life.
And he didn't want a denture.
Absolutely not. No. In fact, his dad wore a denture, and he was terrified of going through what he saw his dad go through. On the flip side, his mom, he hadn't been to visit in, I think, 3 years because he was embarrassed of how his teeth looked. So in one day, we sedated him because he was afraid. He doesn't remember a thing. We replaced his broken down teeth with a full new set of teeth that don't come in and out. He can eat and chew whatever he wants to. Let's look at the before and after.
This is pretty
Now,
dramatic.
Yeah, I want you to tell me what you see in the difference between the
Well, he's
before and
definitely,
after.
like you said, I mean, he's more handsome. He looks more successful. He looks more vibrant. I'm not trying to side with you, by the way, but he looks younger, right?
That's everybody who has this done. Before, they look in the mirror, they don't even want to look in the mirror. After, all they want to do is look and smile and say hi to people and smile. It's contagious because they find themselves again. They've been lost somewhere, and you wouldn't think teeth would find who they are, but Vic, in fact, before we did this, Vic said, I'm looking forward to being myself again.
It's nice.
Yeah, and so he's himself again.
So they end up smiling more. It's like their idea. They return to who they used to be in a way.
Yeah, I mean, if you put yourself in Vic's position in this before picture, would you smile a lot? Probably not.
Not at all, right?
The after, you look younger. You look. I mean, everything about you just looks better. Of course, I would smile more, wouldn't you?
Yeah.
Yeah. So let me tell you about Julie.
Okay.
Julie had a lot of pain in her teeth. She had a family history of dentures, and so she came to me and said, I know my teeth need to come out, which they didn't. We talked about it, but her and I decided together that's the road she wanted to go down. So we did give her a denture, and she wore that denture, and it didn't take her very long to realize what a lot of denture wearers realize, and that is a denture might look like teeth, but it doesn't feel like teeth. So she came back and said, can we do a snap in, snap out? And so I said yes, and so we put some implants in, and we converted her denture to where it snaps in and out. Didn't take her long to realize, even though this thing snaps in and is much more secure, it still doesn't feel like teeth. They want teeth that just are there and they're not thinking about them. They want teeth that just feel like they're natural teeth.
Okay, so she has the snap in, snap out. You
She
convert
did.
her to
So she came
upper and lower
back and
teeth that don't come
said,
out.
I need something that feels like my teeth.
Let's take a look.
So here's her final set of teeth that don't come in
good.
and out.
Looks good.
You should see the life change that this has sparked in Julie. It's crazy. Anyway, this picture is a perfect illustration of somebody who's been successful in changing their life, and I was grateful to be a part of it. I didn't change her life; she changed it, but she let me participate.
It's very
It was
nice.
Awesome.
Very nice. Time for a couple more.
Okay, this is Carino. She lives in Aspen, which is a few hours away from Grand Junction. She was missing a bunch of teeth. She had some bacterial infection in her gums. She knew that her teeth needed to come out. She went to a place in Denver that's kind of cookie cutter, that they do one procedure only, and that is we take your teeth out, we put in implants, and a set of teeth that don't come in and out. But their price was way too high, and so she came to me hoping that we could do something for her. She didn't want a denture. She was terrified of a denture. There's her final teeth. We did a set of implants that don't come in and out. And so, she had to decide, is it worth it driving from Aspen to Grand Junction to see Dr. Benefield? And of course, I've interviewed her after and said, now that you've been through the process, would you come back to us? And of course, she said, I wish I had come sooner. That's what everybody says. I wish I had done this sooner so I could appreciate what I have now. If I could have had that for 10 years, it would have been amazing. So let me show you another patient.
Okay.
And by the way, all these patients are on our website, so
Okay.
We're breezing through them. A lot of them have videos and stuff. They can tell their stories.
Okay.
So anyway,
Okay.
So this is Joe. That's his before. He never liked his teeth. Had a lot of problems. Had pain. Had it's kind of the same story over and over again. But it's not. I mean, for Joe, that's his life. And so he wanted a set of teeth that he loved nuts. He wanted to eat. He wanted to eat what he wanted to eat.
Yeah.
And so in one day.
Looks good.
We safely took out his teeth, put in dental implants, put in a set of teeth that don't come in and out. Now he can be proud of his smile. Take a look at his before and after.
Yeah.
Before, he's pretty strained. He's not used to smiling. In the after, you can see that he's starting to get more comfortable smiling. He's still not quite used to it because he's got a nice set of teeth and he's never had that before.
Okay.
And so what you see is over time, somebody gets used to getting compliments, smiling, and being proud of their smile. And so their face gets more and more comfortable. As
More
time goes on.
relaxed.
Yeah.
Very nice.
For sure.
I'm going to rush you because I know you still have a stack over there.
Yeah. So Pat is kind of like Carino. He lives in Aspen. He decided to travel down to Grand Junction and just check us out. He had the same kind of problems. He was missing some teeth. He had some gum infection. He couldn't eat and chew like he wanted, but he absolutely did not want a denture. And so he came to us looking for a permanent solution. In a day, we took out his teeth safely, put in dental implants, and gave him a set of teeth that don't come in and out.
Looks good.
One funny thing about all these patients, ahead of time, we talk about the cost of the procedure and everything, and ultimately, eventually, it's comical because probably the most expensive thing about it is now they're comfortable, they're going out to eat all the time, they're traveling.
Okay, so that's more expensive.
Yeah, their life just takes a turn for the better.
That's good.
And it costs them more. So Terry came in with a severe gum infection. Her teeth were getting loose. They were getting longer. She recognized something needed to change. And she absolutely wouldn't even have considered something that would come in and out, removable like a denture. And so she wanted to spend her money on something that was going to last. Check out that after. If you look at just her face, would you say she looks happier?
That's for sure.
Yes. That's the biggest thing that before and after shows me. Before, she's just kind of almost scared of life. And in her words, I used to say good morning to people, but I wouldn't smile. Now, when I talk to them, I smile. So, she was guarding her teeth. Now she loves them.
Very nice.
So let me show you one more.
All right.
This is Jeff. If you look at Jeff's before, he
Oh, wow.
was not used to smiling. See the strained look on his face? That's typical. Remember we talked about people hide it? hard time smiling.
Like when you talk to this guy on the console, do you get excited? I think we talked about this. That you can't help but go, boy, this is going to be good.
It's amazing because I know
Like
what it's going to
you see
lead
the future with this guy?
Yeah, because
like even on the console?
he's had that moment of decision, right? I'm going to do something. And so inside I'm going, I know where this is going to lead and it's going to be awesome. He's going to smile someday with a relaxed face instead of a strained face. Now, there's the reality.
Wow.
Look at that after.
Yeah.
He's learning how to smile again, but his whole world is going in a different direction because of this little change of getting a set of teeth that don't come in and out.
Is this the future of dentistry? Whether it's 50 years or 100 years where dentures as we know them today or bridges as we know them today, they'll be gone? Everything will be supported by implants? Do you believe that?
I believe so, yeah. I mean, the future of dentistry would be awesome if we could figure out how to not let teeth get diseased at all.
Yeah, now people travel, I guess, from all over Colorado to Grand Junction to see you.
Sure they do.
I mean, most of these people aren't in Grand Junction.
Yeah, some are and some aren't, but yeah, people travel many hours to our office.
Is that right?
Yeah, and that's the beauty of what technology has offered us because we can do it in less appointments now than we could before, and so there's less traveling, and so people are more willing to come.
All right, now what is your final message? Let's say, back to, you say there's two groups of people, main groups of people that do this. They still have teeth, but they're really bad with the bleeding gums and the bad breath and loose teeth. And then the other group, they're currently wearing a denture. Let's say they've heard what you have to say. Maybe they saw you from the old days on TV.
Yeah.
But they're still scared. They're still skeptical. Maybe they think they're too old. What do you say to them?
I mean, my short answer would be just come in. Let's talk about it. Let's look at your situation together and see where we go from there.
Okay.
That's easy.
And know your options.
Yeah, yeah. But you know, what I would tell them is what each one of these patients would tell them if they were face to face, and that is, once I decided, you know, I had that moment of decision that I'm making a change, their whole life unfolded. They found themselves again. All these problems elsewhere outside of teeth that kind of spark from this, they all disappear.
Now, we're out of time, but I have to ask you this.
Yeah.
So, even the best dental insurance does not cover this. Medicare, Medicaid doesn't cover this. But you say people are financing this.
I'd say of these 10 patients we looked at today, Randy, probably 8 of them financed it either because they had good credit or maybe a co-signer, a parent, a spouse, whatever, had good credit. And so we just do third-party financing.
Is that pretty much going across the country, not just your office? People are financing these procedures.
These are regular people. These are not wealthy people. They're just people that have found a way and made the decision to move forward.
So no more dentures, in your opinion?
Absolutely not.
You think you could wipe it out in Grand Junction for sure? Start there?
I'd like to start there. There's a lot of denture wearers out there.
Okay, good. I want to thank you for coming on the show. Good stuff. Should they go to the website, make an appointment, or just call your office? Do you prefer?
Just call. They can go to the website and see more of this, but just call.
All right, great. Thanks for coming on the show. Good stuff.
Good to see you, Randy.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.